So we have Josep Figueras today, director of the observatory, who was kind enough to answer a few questions for the young Gashsteiners. He's a young Gashsteiner himself, of course. And so our first question to you would be, after the session we had yesterday on EU health priorities, being that you've been here for some years already and have seen some of these sessions, do you think we keep debating the same topics, or do you think we've made some progress in action in any of those areas?
Tough question. I do believe that the topics have been the same ones. When you look at the themes of Gashing over the years, is all about the determinants of health, the commercial determinants of health. However, I believe there's been a difference. I don't want to fall in the stereotype of COVID. However, it has put health from the Cinderella to play with the big boys, not to sound gender biased, and girls in the field. So we are about cohesion, we are about sustainability, we are about economic growth, we are about peace and security. So that has given us a new platform, not only to punch above our real weight on areas of infectious diseases, but also to demonstrate there are a range of public goods that also should be dealt at European level. Commercial determinants is one. Employment, to the extent that there is cross-border, we need to work together on the health workforce policies. Systems, strengthening systems. So there are a number of areas in which we've been discussing over the years, but we have now the ammunition, we have now the capacity, we always had that capacity, I believe, but now we have the resources and the tools to bring those to other sectors. However, the honeymoon, as honeymoons go, the window of opportunity, as windows of opportunity go, is very short. So we really need to take advantage of this post-COVID, after COVID moment. So there was, before COVID, a BC, in which we were discussing all these things. We have now an AC, where we can actually have mechanisms and tools to implement some of those.
Okay. So we had a second question for you relating young voices. We had the pleasure of participating as young Gashsteiners in the session yesterday, and we thought it was very engaging. Do you feel from your experience, all these years coming to Gashstein, that young voices have been heard at the YFG, that we have managed to participate in this process?
Have you?
That's a good question, of course.
I need to ask you.
We did feel that yesterday. Yes,
I need to ask you, because what I can assure you, Juan, is that there is a real commitment among the governing board of Gashstein and the key stakeholders supporting Gashstein over the years on making a young Gashsteiner not a token. Because concern I have in my field, in our field, is the amount of tokenism about passions, about the ageism, about gender sometimes even, and about the youth. I do believe that it is in the hearts and minds of our colleagues that either we do that or die. A lot of what's happening now comes thanks to the innovations you bring, the social media, the freshness. We are afraid, and rightly so, the slightly older generation than you, to be closed into our own sort of debates and our paradigms of the world. And I think having you on board has made a huge difference. And every year, young Gashsteiners play a more and more key role. Take this year with the EU priorities. Basically, we based a lot of our debate on your first debate, then the second, and then the senior policy dialogue yesterday. We address that as well.
Yeah, well, as a young Gashsteiner, I can say we have been feeling included more every year, which is fantastic. And well, not only young Gashsteiners, but I think everyone felt very engaged by the session yesterday. There were like actionable suggestions, big topics, and everyone left the session with some energy, looking for somewhere to direct that energy, somewhere to learn more or discuss more. What could you suggest about that? Where could we head now after this session?
There are two aspects. One is the debate on the future EU health priorities that will be in the mandate of the new Commission, which would be in the famous letter of the President to the health commissioner. So we've been tasked to support, to work with DG Santé, the observatory has been tasked to do so, to have debates, not consultations, but debates between all the key stakeholders. Young Einstein has played a key role in trying to understand what is the view on the key priorities that the EU, what is that value added, what is the new role in which subsidiarity has measured limitations now. So we will be debating, organizing a number of webinars, open webinars, sessions in several conferences, documents, questionnaires that all the key stakeholders, will be able to be involved. Second, one thing that DG Galina said very clearly yesterday, I think you could see the appetite she has for change, but she is a civil servant and needs to follow, and rightly so, the views, the leadership, the mandate of the member state. But there is an appetite not only in the Commission, which matters less because they are civil servants taking their task, but in the room. There is an appetite in the NGOs, there's an appetite on the industry to work differently, there's an appetite on policymakers. I see now policymakers begin to question some stereotypes about the limits of us working together at the EU level. So what we need is, as Sandra Galina said yesterday, it is member states that need to go to the Commission to get that support, to get that tools, to take this new public goods. So I repeat, Juan, go well beyond viruses or AMR. Very important, but go beyond that to a number of other public goods that member states have to work together. But the push needs to be by you guys, by NGOs, by professional groups in member states.
Yeah.
It's a stereotype to talk about bottom up, I know. But
that's it. Right?
when push comes to shuffle,
Yeah.
it has to be bottom up. Otherwise, there's little you can do in Brussels.
Okay, well, thank you very much. And I think we all feel very excited to move forward with that bottom-up perspective. So thank you for your time.